Hi, I'm Dr. Jennifer Kang, founder at Selah. I'm going to go through what you can expect in preparing for surgery with one of the surgeons here at Selah. You will get handouts that actually will make for lovely bedtime reading. And they may look like this. They may look like this. Depending on revisions may look different. But I want to give you a sense of what to expect and talk through the details a little bit more. We want to make sure that as you're planning surgery with us here at Selah, you feel really comfortable. There's going to be lots of things and questions on your mind, and we want to try to ease as many of those as possible because we don't want any fear involved. Okay, so I'm just going to kind of talk through what to expect as you prepare for your hospital for major surgery. You'll notice on the first page of your handout that there's going to be what we call a cheat sheet. And this is basically just to review for you and summarize what times you're expected to do what. And there's a whole bunch of things, some pre-op appointments, some post-op appointments. We put that all here on this first page, helps you organize what to expect. And then on the second page, you're actually going to find some instructions about what to do before surgery. And that looks like this. Things like eating. So generally, we don't want you to have anything in your stomach when you come into surgery because under anesthesia, everything relaxes and there's a risk that anything that's in your stomach can come up your esophagus and actually get into your airway. And that would lead to a risk of pneumonia, and we definitely don't want that. So it's really important that your stomach is completely empty when we do surgery. That also includes not chewing gum because gum can actually get stomach acids going, and that can come up. We don't want acid to come up either. So the general rule of thumb is somewhere between 10 and 12 hours of nothing in your stomach, okay? You can drink water up to 2 to 3 hours before surgery, and we recommend that before you leave for the hospital for your surgery that you do hydrate because that will help make sure you're not dehydrated when your nurse is trying to put your IV in, make it a whole lot easier for you. The other things we talk about is the week before surgery, we want you to avoid medications that can thin your blood. And those include aspirin and ibuprofen. If you're on a prescription blood thinner, then we are going to make a plan for you ahead of time to make sure that we have a plan to stop your blood thinner in time for surgery to be safe for you. And usually we work in coordination with your cardiologist to make sure that plan is good. Okay? But make sure before surgery that week you're not taking aspirin, ibuprofen, Aleve, anything that's a non-steroidal anti-inflammatory to prevent your blood from being too thin and to prevent you from bleeding too much during surgery. Showering and shaving, depending on your surgery, usually a major surgery, we're going to want you to use an antibacterial soap right before surgery. Sometimes the hospital will actually provide that for you. We recommend doing that the night before or the morning of your surgery. Shaving is always a question we get. We actually recommend that you don't shave the day of surgery. That can actually increase the risk of stirring up bacteria or micro nicks in the area, and that can increase your risk of getting an incisional infection. So the day before, the day of, don't shave. If you do want to do a shave, do it several days before. Alternatively, you don't have to shave. If we find that your surgery would be safer with hair removed, we'll actually do it at the time of surgery after you go to sleep. There are many surgeries we do that actually don't require you to have any shaving done. And so it's very reasonable just to leave that part to us, okay? The day of surgery, make sure you're wearing comfortable, clean clothing. Don't wear jewelry if possible. If you have piercings, take them out. If you absolutely can't take out a piercing, talk to us at your pre-op appointment about options for you. The reason we say to take out all jewelry is that we often are using cautery during surgery. And that cautery is a form of electricity, and that can be transmitted through your body to your metal piercing and cause a burn at the site of your piercing. We don't want that. Sometimes if a piercing just cannot be removed, we're able to pad it or insulate it. And so we can work on that together. But best if you can plan ahead of time to get that jewelry off. Okay. And finally, wear glasses the day of surgery instead of contacts because we don't want your contacts to get dry or to get damaged during your surgery. So it's better to wear your glasses. We'll make sure that they're right there for you when you wake up. The same is true for dental appliances. You can wear them to the surgery center, and right before surgery, we're going to have you take them out and put them in a special container so that those don't get damaged in any way while you're asleep. The next page of your handout is a list of herbs and supplements that you want to try to avoid in the 2 weeks prior to your surgery. Again, the reasoning is the same as for aspirin and ibuprofen. Some of these can interfere with anesthesia, or they can increase the amount of bleeding you have at surgery. You'll notice one of the things that people ask me about is garlic. Garlic is on the list, and that's not garlic in the form of cooking. It's garlic in really concentrated form, like garlic capsules. So if you take that for your health, stop taking that 2 weeks before surgery so that you don't have increased risk of bleeding. If you're using illicit drugs or marijuana, those can actually interfere with the anesthesia medications that we need to use and actually make them less effective. So we recommend that you don't use any of that in the week or two before surgery if you normally do. Medications, on my brochure, it's empty. On yours, we may fill in a few things because we want to make sure that we talk about this together at your pre-op visit. It's one of the things we need to make sure we have a good plan for. What of your medication list do we want to make sure you take the day of surgery? And what of your medication list do we want to make sure you don't take? So make sure that we have that discussion with you. There's actually some blood pressure medicines, for example, we don't want you to take the day of, or some diabetes medications because you're not eating that day. So we don't want you to end up with a problem because you took your diabetes medication. Okay. So we'll fill that out together when you see you for your visit. After surgery is our next page, and that's talking about eating and medications. Some of this is kind of common sense, but we want to go over it anyway. After surgery, usually the surgery anesthesia medications and the pain medications that you're taking, they slow your bowels down. And so you want to just be real respectful and gentle to your digestive system after surgery, and don't make it work too hard because you will pay for it with nausea. Okay. So one of the things you recommend is that before surgery, you actually, that day right before surgery, you just have clear liquids, or maybe some broths and smoothies, just liquid diet, because that will help to kind of move things through and make sure that you're not overloaded before surgery. Like, don't have a big steak dinner the night before. That will help decrease the amount of nausea you have afterwards. And remember, your gut is going to slow down after surgery. And so that whatever you have the day before is going to take a while to get through. It's nice to be able to set yourself up so that you don't have more bloating and gas after surgery. A bland diet is what we recommend. So not a lot of spicy, not a lot of greasy, heavy, rich foods. Think more like toast and tea at first. Make sure you're getting through that first part of your recovery, and things are moving fine. You're not having a lot of nausea before you start adding in more. It's very important for wound healing that your body has enough protein. Your body does this like mysterious and almost magical thing during wound healing and closes it all up. We do the surgical work, but your body has to have the space and the ingredients to do the magic. And part of that is protein. So making sure you got enough protein. If you don't eat meat, then think about your other protein sources. It's fine to eat a vegetarian or vegan diet post-op, but make sure you get enough protein. Sometimes that could look like protein shakes after surgery to make sure you're getting enough. How much is enough? Somewhere between 60 to 80 grams of protein a day. Particularly when you're not maybe feeling up to eating big meals, that protein shake might come in handy. Finally, the other thing we recommend in your diet is to add some extra vitamin C. Vitamin C is really helpful to boost your immune system to help prevent complications of infection. And it also does help with wound healing in addition. So adding a vitamin C, if you're not already taking it, would be really helpful. Medications. We're going to send in prescriptions for medications for you to take after surgery. Most of the time, that's going to include pain medication and a stool softener. We have this saying in medicine that the hand that writes the pain medication prescription should simultaneously write the stool softener prescription. Why is that? Well, pain medications notoriously can cause constipation. And we don't want you to be in pain, but we also don't want you to get backed up because that's going to cause more pain. And so there's this fine balance. We usually will prescribe a narcotic, that's like an opiate or controlled medication for pain, and a higher dose ibuprofen. if you can have those. And we try to give you both options so that you can use what you need. And if possible, not use the stronger narcotic pain medication if you don't need it. Some people find that they do just fine with Tylenol and ibuprofen. Some surgeries, you really do need it, and you're not a wimp if you do. Some of these surgeries, there's significant discomfort afterwards. And just toughing it out and being in pain is not always the best choice, because if you are like scrunched over in pain, you know what you're not doing? You're not taking big, deep breaths. And we don't want you to not get air all the way to the bottom of your lungs after surgery, because we don't want the bases of your lungs to collapse and put you at risk for pneumonia. So you see, there's kind of a balance, like take the pain medication if you need it so that you can move and you can breathe well. But don't take it if you don't need it. Just take the ibuprofen. If you're somebody who can't take ibuprofen, we'll talk about that together at your pre-op visit and come up with some alternatives. There are different options in terms of pain medications. Some people do better with some versus others. Sometimes it's a matter of your insurance coverage, and sometimes it's a matter of side effects that you've had with prior experience. So be sure to talk through that with us. We like to get those prescriptions sent to your pharmacy before surgery so you can get them picked up. We make sure there's no issues with your insurance, and you have them ready so you don't have to think about that after surgery. That's the last thing you want to be thinking about when you're groggy and trying to get home. Next page in our brochure talks about activity restrictions. And this is where we have to get stern with you. We know you ladies, you like to think you can do everything, and you're amazing. You're Wonder Woman, multitasking and balancing. But this is actually a time where you need to take time for you, and you need to give your body space to heal. Some of the surgeries that we do for our patients are reconstructive surgeries. And it's really important that you don't put too much strain on those stitches, because they can pop and then you have a problem, whether that's bleeding or your repair doesn't last and we have to redo it. Wouldn't that be terrible after going through all of this and it doesn't last and we have to redo it? So we need you to follow our instructions. We're very stern about this. Follow the activity restrictions and you won't have complications, okay? So in your handout, you will notice that there's level 1 and level 2 restrictions. If you are having a major surgery, which includes things like hysterectomy, prolapse repair, a sling placement, you need to make sure you follow level 2 restrictions. If you're having a minor surgery, like a tubal or a laparoscopy for diagnosis or a hysteroscopy to put the camera inside the uterus and to take samples or remove a polyp, those are all minor surgeries, and level 1 restrictions would apply to you. Level 1 restrictions apply usually for 2 weeks, and that includes, we really want you to avoid the gym. We want you to just do light activity like walking. You don't have to sit on the couch all day, but being somewhat inactive for 2 weeks is important. Let those stitches heal. We don't want you to lift more than 15 pounds. We don't want you to submerge because you have incisions or we dilated your cervix. We don't want water to get up inside your uterus while you're recovering and while that cervix is closing. For level 2 restrictions, it's actually super important to follow them really carefully. These are major surgeries, lots of layers of stitches. And most importantly, when you are upright, standing or sitting, you're actually putting your body weight on those stitches and they have to hold. And so we usually recommend that first 2 weeks of your 6-week recovery that you be a couch potato. And what that means is you're reclining a little bit. You're at an angle so that the weight of your body is not pushing on those stitches. It's going to be easy to do that first week because you're sore and you're tired. After that, it gets increasingly more difficult to make yourself do the right thing, but it is important to do so. That first 6 weeks, your stitches internally can pop at any point if you do too much. One of the signals that you might be doing too much is you might have some bleeding from your incision. So you might see that on your abdomen if you have an abdominal incision, or you might see that coming out from internally if you have internal stitches. And if it's bright red and it's increasing, that's the warning signal. Lady, go sit on the couch. Lay on the couch, preferably, okay? We do expect a little bit of bleeding and spotting after a hysterectomy or prolapse repairs. That's really normal, and that's just the wound healing process. But if you are saturating a pad, that is more bleeding than we expect. You should lay down the couch, rest. If it gets better or goes away in an hour, you're fine. If it doesn't, you need to call us. We always have a doctor on call, even after hours. And the way that you can get through to that doctor after hours is just stay on the line when you call Selah. The answering service will answer. You tell them what's going on. You tell them it's an emergency after surgery, and they will connect you to the doctor on call. That way we can talk through your symptoms with you and find out if we need to see you emergently. Okay, upright position. Remember, not longer than 30 minutes at a time. That first 2 weeks, we want you to be real careful. So that means you can get up and you can make yourself a sandwich. You can have a shower. You can, go outside and get some fresh air. But after 30 minutes, we want you to lay back down, recline. And that's really important to take some pressure off. After your 2-week visit, we're going to be able to tell you, how is the healing process going for you? And can you maybe lift your restrictions a little bit? And that may mean we may tell you you can be upright longer. Remember, upright is also sitting straight. So if you're somebody who's, maybe you think you're going to work on a puzzle, or you're going to do some sewing or some piecework, think about that too, okay? We want you to be reclined for the most part during that first 2 weeks. The other issue that comes up sometimes is driving. When can I drive? And there's 2 answers to that, but the simple answer is 2 weeks. You need to not drive the first 2 weeks. And this has to do with, well, where are you going? First of all, because you're not supposed to be doing much but laying on the couch. And second of all, a lot of auto insurance companies will actually deny payment for an accident claim that happens within 2 weeks after surgery, claiming that your surgical recovery somehow interfered with your ability to drive. So you don't want to get stuck with that bill. So that's the other reason. And then finally, if you're taking narcotic pain medication still, you should not drive. I know that sounds like common sense, but just so you know, those medications can make you groggy. They can slow your response time, and you shouldn't be operating machinery after taking them, okay? You can probably drive yourself to your post-op visit if you'd like to. On the other hand, bringing your partner or somebody who lives in the house with you is great for us, because they're going to tell us the truth about whether or not you've been following our instructions. All right, the activities to avoid, there's a little list in your brochure that's actually going to make you laugh, because we've put in the things in there that honestly people have done, like paddleboarding, gardening. I had a patient who actually cleaned out her gutters. That didn't go well. It ended up back in the operating room. Please don't do it. Don't use this post-operative time to redesign your house, remodel your kitchen, paint your bathroom, or reorganize your closet. That should all wait for another time. This is the time to get into some new Netflix series. My personal favorite I recommend to everyone is Call the Midwife. They don't pay me for that, but it's a long series and it's very fun. But if you're not into OBGYN, maybe not. All right, reasons to call your doctor. We are at the last page of instructions, and these are to give you an idea of what is not normal after surgery. What should prompt me to think, maybe something is not quite right, and I should find out if I need to be seen. There are normal things, but these are the ones that are not. So if you have a temperature that's greater than 101 degrees Fahrenheit, that could be a sign of an infection. It's actually pretty normal to have a low-grade temperature the first few days after surgery, especially after uterine surgery. But anything over 101 is a true fever, and that's a little bit more concerning. So we'd want you to call us. If you have pain that increases, now remember, we do expect you to have pain. We haven't yet mastered the skill of painless surgery. So there's gonna be some, and everyone experiences it differently. Some people experience post-operative pain as minimal. Maybe you've had a lot of pain and that's why you're having surgery. You may actually feel less pain after surgery, after that offensive uterus is out, for example. On the other hand, you may be surprised. You think you're tough, and then you're like, oh, this is kind of a big surgery. This actually hurts. So we do expect some. What we don't expect is that instead of gradually over the first 2 weeks, the pain getting a little better and a little better, it's getting a little worse and unbearably worse. The first thing to think about if your pain is getting worse is, when was your last bowel movement? Because that's a number one cause of increasing pain. You start to get bloated and distended from constipation. Other issues, inability to urinate. Some of you will go home within hours of your surgery. Most of the time, we don't let you go home without intervention if you haven't peed. But if you somehow sneak through and then your bladder doesn't work afterwards, you need to know you should not wait longer than 6 hours. If you can't pee, first of all, you're going to feel not so good. You're going to feel distended. You're going to feel pain. That's not going to be pleasant. But if you let it go too long, you can actually over distend your bladder and damage it. So we don't want that to happen. If you can't pee, you've done everything. You've sat in the relaxed, dark bathroom. You've turned the shower on. You've tried to pee in the shower. You've turned the water on, everything you can think of, and you still can't go. You need to call us. If it's after hours, you're going to need to go to the emergency room. And the reason is, sometimes the bladder will just freeze up from post-operative pain medications or anesthesia effects. Sometimes it's the surgery itself. The bladder had a lot of surgery done to it. And so we have to put a catheter in to make sure that you don't get damage to your bladder. It's not the end of the world. It sounds terrible, but it is not the end of the world. It usually doesn't result in any long-term consequences, but you do need to address it sooner rather than later. If you're having a lot of nausea and vomiting and you actually can't keep fluids down, then call us. If you're having heavy bleeding from internal areas, that's really important to call us about, like we already discussed. And finally, allergic reactions. You don't need to call us if you have a little bit of a rash around your incision. We can talk about that non-urgently. But if you are having facial swelling, if your tongue is swelling, if you've got a bad rash or swelling around your neck, we need to call us or come straight to the emergency room. That might be a very significant and severe allergic reaction. Constipation, my favorite topic. So when should you poop after surgery? For everyone, it's a little different, but like I said, it's not uncommon that everything slows down at first. So it may be a few days before you have your first bowel movement. And our recommendation is you don't let more than 3 days go by between bowel movements while you're recovering. And that's gonna be about the time when we expect you to have your first one after major surgery. If you don't have your first bowel movement after 3 days, then you do need to do something before it gets worse and you start to have pain and bloating and feel really miserable. And so in our brochure, we actually have a couple of options and recommendations for doses of what to take beyond just your stool softener that we gave you. And our 2 top favorites are milk of magnesia and magnesium citrate. So if you think magnesium, you're thinking the right thing. The reason we say milk of magnesia is not because we are old school, or because it's particularly delicious, because it's not, but because it's mild and it's gentle. A lot of the laxatives that are out there on the market over the counter are pretty tough on you, and they do work, but they give you a lot of gas pain and it's pretty explosive. So try the gentler thing first, and that would be milk of magnesia. And we usually recommend taking a dose, waiting 6 to 12 hours. If nothing has happened, take another dose. You can take it twice a day if you need to, but usually after the first or second dose, you're good. If you're not, go to something a little bit stronger like magnesium citrate. If you still haven't gone after that, maybe you need to call us. Maybe you need to try a suppository like Dulcolax, and we'll go from there. Usually the first things work pretty well. Again, if you can think about incorporating into your diet after surgery, fiber-rich foods, magnesium-rich foods, those are going to help keep things moving and maybe prevent you needing to address it with medications. We made it through our entire post-operative care bulletin, and you will have time to discuss maybe more questions that have come up when you sit down with your surgeon right before surgery at your pre-op visit at Selah. But this will give you at least an overview of what we want to make sure you know and set you up for success so that you can truly heal well after surgery.